Hi, I'm Dr. Mukesh Gupta from Lenest, Malad. Stress during pregnancy. Well, the questions which crop up immediately with this subject is, why do women have stress during pregnancy? What is happening in the body when they have stress during pregnancy? Does it have any impact on the mother? And does it have any impact on the baby which is growing inside? And will it have impact on the process of labor? These are the top 5 questions which come on our mind. Let's answer them today. Women in general have a lot of hormonal changes happening in the course of their life, whether it is at the start of puberty when the menstruation starts, or whether it is at the end when the menopause happens. And in between, there's a whole bundle of energy and bundle of hormones which are changing into the body, and that is at the time of pregnancy. And that predisposes them to a lot of stress and a lot of anxiety, emotional lability, irritability, changes in the body, physical pains, aches, and all those adaptation that is happening in the body predisposes them to stress. Add to that the adaptation around them, family causing a lot of restrictions on movement, on eating, on traveling, on doing anything, everything. It only adds to the stress in the woman's life, especially when she's pregnant. What is happening in your body when the stress happens? Well, at the time of stress, like in fear, fight, fright, the hormone level changes. The body is actually adapting to that stress. There are some hormones like cortisol, which is abundant in the phase of stress, and it is actually not only circulating in your body but also passes on to the baby. And then a lot of more things which are happening during the stress, where your body is actually adapting to that environment of stress and responding to that, and a lot of efforts is being taken by your body for that process. That brings us to the next question. Will it affect the woman when she has stress during the pregnancy? That's the third question that we were wanting to answer. Well, stress in itself can affect a woman, whether it is psychologically or whether it is physically. When she is going through these phases, at that time, lack of sleep, irritability, inappropriate rest, it may be a cause or it can be an effect because of the stress. It also leads to enhancement of her body aches and pains, and last but not the least, it has very bad impact on her compliance to the regulations or the safety mechanism that she needs to follow during pregnancy. Of what all things she is not supposed to do, she'll say, "Chana sab kuch, I don't care, I want to do this." And that attitude is also a response to the stress that she goes through. Well, poor compliance leads to lack of their approach to the healthcare facility, not taking their medicine properly, not eating well, not taking safety precautions when they are moving around or traveling. All these factors affects her health. More than anything else, it is also increasing her chance and risk of landing up with infections and accidents. Now, what is the impact on the baby? Well, it is definitely a fact and known fact that these hormones can be passed on in some amount to the baby and bring about a different change. Historically, when studies were done in women who have been exposed to calamities or major stress or wars or any post-traumatic stress syndrome kind of situation, they have found that these babies born out of those mothers had a little different kind of outcome as compared to others. What are the things that have been shown to be increased incidence? A, risk of preterm birth, leading to risk of infection and other associated problems of prematurity. Another thing is the cognitive development of the baby, which has been poorly affected when woman is under stress during pregnancy. These children have been found to have higher incidence of behavioral disorders like attention deficit or similar such things. Even psychiatric disorders like schizophrenia have been associated with stress during pregnancy or difficult motherhood. Last but not the least is that baby inside the mother is actually getting programmed. We call it fetal programming. The baby has been exposed to this stress around the internal environment, meaning the baby is getting prepared thinking that when the baby comes out, there is going to be a lot of stressful environment. And this actually has an impact which has been proven in studies where they say that the babies who are low birth weight or are preterm because of stress factors, and when they are born, and then when even if they cover up, still they have higher incidences of adult onset diseases. So we need to be very careful, because our stress is not only impacting us but also the baby, and not just now, all through the life. And that brings us to the last question. Will it affect the labor? Yes, it does. A woman who is extremely stressed out and worked up about the labor and its relevant issues is at higher chances of having a prolonged labor or a difficult labor. Not only that, there is also higher risk of preterm labor. Well, if you go in scared for the labor, it is going to be very difficult and you will feel that you've gone through a very topsy-turvy time. But if you go in happy and relaxed, and if you have gone through phases where you are able to cope up with various different techniques and methods that you can take care, which we're going to discuss in another video to reduce the stress. If you follow that particular pattern, it is going to take you to a very healthy and happy motherhood and a very smooth labor. So remember one thing, there may be hundreds and billions of causes for you to take stress, but there is only one reason why you should not, and that's to take care of your health and your baby's health. Take care.